Cutting carbon and improving health. This short presentation is for all staff who work for the NHS. It explains why carbon emissions matter and what the NHS must do to play its part in their reduction. First, we'll look at some technical elements which explains how carbon has become both essential and a problem to human life. Next, and most importantly, you will hear the links between this and health. Then you will hear what the NHS and you can do right now and in the future to cut emissions and improve health. All living things are made of carbon. Carbon is also a part of the ocean, air, and even rocks. Because the Earth is a dynamic place, carbon does not stay still. It's on the move. In the atmosphere, carbon is attached to oxygen in carbon dioxide. Plants use carbon dioxide to make food through photosynthesis, and the carbon therefore becomes part of the plant. Humans and animals then eat the plants, and when the humans, animals and plants then die and are buried, the carbon enters the soil and over millions of years may turn into fossil fuels. When fossil fuels such as coal and oil are burnt, the carbon re-enters the atmosphere as carbon dioxide, a greenhouse gas, which traps heat in our atmosphere. Without it and other greenhouse gases, Earth would be a frozen world. However, humans have burnt so much fossil fuel that there is about 30% more carbon dioxide in the air today than there was 150 years ago, and Earth is becoming a warmer place. 350 million years' worth of carbon was locked away in fossil fuels, oil and gas. In the last century and a half, we have transformed our world. Our discovery and exploitation of plentiful fossil fuels has led to a huge population increase, and for an ever-increasing proportion, a much more resource-hungry lifestyle. It was only 150 years ago that the first oil well in the world was drilled. Only 100 years ago, there were a mere 4,000 cars in the whole of the USA. Barely 50 years ago, the first commercial jet flight took place. Today, there are 600 million cars in the world and 4 billion flights every year. Nearly all are powered by fossil fuels. Together, they have contributed to a huge increase in greenhouse gases. These gases are called greenhouse gases because they trap the sun's warmth in the atmosphere. Because of the burning of fossil fuels, greenhouse gas emissions have accelerated. We have released 930 billion metric tons of CO2 in the last 150 years, with half of that escaping since 1970. Greenhouse gas emissions are creating global climate change, which is inextricably linked with shortages of energy, food, and water. These lie behind nearly all human conflict and disasters. Our systems for fertilizing, irrigating, processing and transporting food are highly dependent on energy, and water sources are becoming increasingly stressed. While in developed countries, diseases caused by overconsumption are rising, in some developing countries, food shortages are a threat to people's very existence. Abundant, cheap fossil fuel has led to an environment which depends on high energy inputs, more accidents on our roads, the 9th highest killer in the world, according to the World Health Organization, air pollution causing cancer, bronchitis, heart disease and asthma, physical inactivity. As we drive more, we walk less, leading to obesity, diabetes, stroke, disability and heart disease. Traffic congestion. In China in 2010, a single jam covered 200 miles and took over a week to clear. Climate chaos, with ever-increasing severe weather events. Unprecedented droughts, for example in southern Sudan and Somalia, and floods like those suffered recently in Tewkesbury, Australia and Pakistan. As supplies of easy-to-reach conventional fossil fuels dwindle, our attempts to find enough alternative power are creating increased environmental damage. In the huge tar sands area in Canada, colossal amounts of water and gas are needed to force out the oil, and the landscape is obliterated in the process. There are barriers to using renewable energy. Solar energy in the UK is lowest when power needs are greatest. Wave energy is abundant but difficult and expensive to capture. Wind power is plentiful but intermittent, and the windmills dominate the landscape. New pylons and cables will need to be built across sensitive landscapes to bring such power to the grid. This means... Does all of this mean that human life on Earth is doomed? We are too late to avoid global warming altogether. It's already here. Warming will continue due to greenhouse gases already released. But not too late to reduce further loss of species, limit the rise in global warming, keep the climate within the range in which human civilization evolved. And this is important in the NHS because the Sustainable Development Unit has calculated the carbon footprint of the whole NHS, a first for any healthcare system in the world. This shows that while transport and buildings are important, the largest share is caused by procurement, all the good sport. The greatest proportion of these is drugs and medical supplies and surgical equipment, with nearly 2/3 of that total. Not only is hospital inpatient care most expensive in cash terms, it also has the largest carbon footprint. Fewer, shorter hospital stays are essential. Outpatient visits, by comparison, are less carbon intensive, but not insignificant in view of the huge number. Ultra-fast broadband and home care can play a role in reducing this. However, computers too are energy hungry. If we are to have any hope of reaching the government's mandatory target, we must radically change the way we work. And the NHS has already made a start in most trusts and at a national level with its route map to sustainable healthcare. We must act for the following reasons. It's the law. A mandatory 80% cut is required by 2050. It will help make savings in cost, tax, and enhanced reputation. Health gain. It is our core business. Resilience, also known as health protection, limiting the impact of floods, fuel shortages, heat waves, epidemics, and civil unrest. Leading by example, proving action is not only possible, but produces benefit for all, a win-win. Immediate health co-benefits for both individuals and the healthcare system. We can only make this change if you, our staff, take action by reduce your printing or avoid altogether and use colour sparingly. Change suppliers for greener products. Recycle all waste. Is that meeting really necessary? Could you have a telephone or video conference? Involve your colleagues. Everyone needs to help. Do you need the heating on? Can you wear another layer? Don't waste heat. If you need to open the window, turn the heating down. Do you need to drive to your destination? What about walking, cycling, or using public transport instead? We hope this presentation has inspired you to find out more about helping the NHS to meet its carbon reduction targets.